Okay, part 2. This article focused around a 22-year-old competitive gymnast that had been present in 7 months post-shoulder surgery and has significant impairments and functional limitation. They tried to use dry needling to improve her muscle thickness to see if that could help her bounce back faster, not to get injured again, and be stronger and better than she was before. So in this table, it focuses on the infraspinatus thickness. And the one that she had surgery on is the main one that we're focusing is a right inferior infraspinatus. So at rest, the muscle diameter was a 10.5. And then in the pre-treatment, before we started all the dry needling stuff, she scored a 15.2. And after the treatment and after the dry needling, it bounced all the way up to an 18.9. And that is huge. And then they focused on her right superior infraspinatus. And at rest, it was a 9.8. Before treatment, it was a 17. And it didn't move much, but after treatment, it was an 18.2, which showed that's an increase. So for the outcomes of it, it was immediately after dry needling, the infraspinatus muscle thickness was significantly proven as measured by the ultrasound imaging that they used. And there was a corresponding increase in the force production of the external rotation of 90 degrees of an abduction. So since her muscle got larger, so did her strength got stronger too. But there is also minimal research that indicates that the potential of dry needling on muscle functions, as assessed by muscle thickness measured using rehabilitative ultrasound imaging. The results of this case reported suggest that dry needling contributed to the improvement in the muscle thickness and in the strength with muscle dysfunction following the injury. So this case study proved that the dry needling helped her muscle grow in size and diameter and the strength of it, and she was able to get back to gymnastics. So the next one is on a runner's point. A runner's point, it's very hard to actually tell you what it is. It's just a very sharp pain that happens around this area in the calf, in the back of the knee. And it's like a pull and a stretching feeling, and it kind of burns when you walk or run. So they focused on where the calf muscle was painful at and where the needling needed to be to kind of take away the stretching and the pulling sensations and decrease the pain. And most of the time where the runner's point hurts the worst is with the heel strike of when running. So it really affects mainly the people who are flat-footed more than people who run on their toes. So, but there's many different places that they try to dry needling and focus around, which was the calf strain. We just talked about that. Plantar fasciitis can cause runner's point to happen because it's a trigger point. And the inhibit of the dorsiflexion can also cause a runner's point to happen. So the next one is the sensory stimulation acupuncture for the treatment of idiopathic anterior knee pain. So the sensory treatment is basically, it's kind of like a stim machine, but it's attached to the acupuncture needles. And they focus on the study with the knee pain. First, they did the baseline to where the patients and the athletes were having trouble with their knee the most, which was the stairs, squatting, or actually prolonged sitting and getting up. They had a hard time getting back up. And of course, walking. So after they did the baseline, they did acupuncture. And this time they added the electrical stimulation with it to see if it would help decrease the pain faster or if it does the same effect that everything does. So the total of the 57 patients that completed this study, there's a so it showed that there wasn't a difference between regular dry needling and then the dry needle with the stimulation, and that the effects were basically equal of this study, as you can see in this chart right here. They're all about similar, about the same spot at the 72 hours after the treatment. So the next one is the comparison of dry needling versus sham on the performance of a vertical jump. In this study, there are 35 healthy student athletes that participated in it. There are 19 males and 16 females. They were then placed 4 points in each leg. The needles were inserted. The sham group had 4 areas of the gastrocnemius muscle and both legs pressed with a tube housing the needle after palpation. But the needle was never inserted into the skin. After both of these groups were done with their treatment, then they were made to redo their baseline, such as the vertical test. To sum that up, basically they had a group that got the needle inserted into their leg, which was the dry needle. The other group was the placebo that just got a tube, but the needle was inside the tube, but it never touched the skin. So as we look in this table, the sham stayed the same, basically. But when we go to our dry needling, it, from pre to post, it had a significant difference that showed. It might not had it had a maximum, it didn't go down, but it did go up by 2 inches. So, overview of my research, I saw there was improvements, like the pain, muscle diameter, but there are some limitations that kind of can hurt these case studies and needs to be more research. Was the sample sizes were too small, or the sample sizes, they didn't last throughout the whole entire thing. And there needs to be further research because some of them showed that it's only a short-term effective, but then some might say that it's long-term. So it really just needs to be more of a research done to see if it is a long, effective process, because that's what we need as in athletes. We need something that can stay and not be a band-aid on us. So some other uses of dry needling is pain control, reduction of muscle tension, normalizing biomechanical and electrical dysfunction of motor end plates. So in your back and stuff like that, it can help with the plates, and if you slip a disc or something like that, it can help with the pain and stuff like that. And then the facilities and acceleration return to activities. And so the goals of dry needling that people focus on is the release and the inactivate the trigger points and to relieve pain. Because the only way we get our pain is from our trigger points that are too tight and being strained, and we need them to relax. So some overview on the limitations with dry needling. So as I said before, the sample sizes were too small. So, and then a lot of the articles didn't have a control group. They only had one person that was getting the dry needle, so they had nothing to compare to. So then there was also some side effects that can be caused by dry needling, such as rashes, and if they're allergic to the needle type, like the metal, or not being clean, other stuff like that. And so there are my references, and thank you so much.